Daniel was a 35-year-old gentleman that came to my office because of pain and swelling in the right hand. That was ongoing for about 2 years. Before seeing me, he was seen by a few other specialists, received treatment, injections, without any improvement. I spent an hour taking the history and examining this patient. Daniel had 2 of his fingers very swollen, but there was a lot of pain and he could not close his fist. He had severe morning stiffness in his hand and lower back, which lasted for hours, but it was improved by movement. I found out that he had an episode of inflammation in his right eye a few years ago. He also had a few patches of redness, scaly skin, and an itchy rash in his scalp. Years ago, he also had a similar patch and rash around his belly button, but that went away. After a few other tests, I was able to diagnose Daniel with psoriatic arthritis. Unfortunately, there are many patients like Daniel that are seen by other specialists before they get to rheumatology. In this lecture, I will teach you the most common signs and symptoms of psoriatic arthritis.
rheumatologistoncall.com.
Hi, I'm Dr. Diana Granita, a board-certified rheumatologist and the founder of Rheumatologist on Call. If you are new here, welcome to my channel where I educate people about autoimmune diseases like psoriatic arthritis and rheumatoid arthritis and other autoimmune diseases, but I also teach them how to improve their life and thrive with a diagnosis of arthritis. If you have been following this channel for a while, I'm excited to have you back and share more information with you. From this story, you may see that most people with the diagnosis of psoriasis, they do struggle until they get the diagnosis. As most common, this diagnosis is overlooked and it is delayed. What is happening? Why is this happening? Well, as you saw in my example, my patient's symptoms involve both joints and also skin. So when patients suffer from the skin problem, they will go and address that problem with a dermatologist. On the other hand, patients do not mention their joint pain to the dermatologist because they don't think it's related. On another hand, when they have joint pain, they go to be seen usually by an orthopedic specialist, and there they don't mention that they have a skin disease. So it takes time and years until somebody sits down with them and diagnoses them properly with psoriatic arthritis. Now let's dive deeper and understand what is psoriasis, what is psoriatic arthritis, and what are the common signs and symptoms of psoriatic arthritis. Before we begin, I would like to remind you that this video is for educational purpose only and does not offer you medical advice and does not substitute a diagnosis. If you are concerned about psoriatic arthritis or any other arthritis disease, go and be evaluated by a rheumatologist. What is psoriasis? Simply put, psoriasis is an autoimmune disease of your skin, and it can affect about 2 to 3% of the population. It may affect your scalp, elbows, knees, ears, eyebrow, and buttock area. There are many types of psoriasis, but that doesn't make the scope of my lecture. And if you want to be evaluated, you need the help of a dermatologist. What is psoriatic arthritis? only about 25 to 30% of patients with a skin disease, skin psoriasis, will actually develop back pain or other joint pain. This is not immediately, as many patients will develop joint pain about 6 to 8 years after the skin is affected. Remember, males and females are equally affected by psoriatic arthritis, but back pain is more commonly seen in males. Also, about half of the patients with back pain, they also have an HLA-B27 positive. If you want to learn more about what HLA-B27 is and the relationship with back arthritis, watch this video in my channel. What are the most common signs of psoriatic arthritis? Psoriatic arthritis, like ankylosing spondylitis, it is part of a large spectrum of diseases that we call spondylarthropathies. As a result, there is inflammation of the joints, the spine, but also other organs. If you want to learn more about ankylosing spondylitis, I posted a video about that. Now, let's find out what are the most common signs of psoriatic arthritis. Back pain. A common symptom is pain, stiffness, and difficulty moving. The pain improves with movement, while resting makes the pain and stiffness much worse. However, the pain seems to be more on one side of the back, causing what we call unilateral sacroiliitis, or inflammation of the sacroiliac joints just on one side of the body. This is often how we differentiate psoriatic arthritis from ankylosing spondylitis or other inflammatory diseases caused by inflammation in the gut, which more frequently will affect both sides of the sacroiliac joints. Joint pain. Many forms of psoriatic arthritis affect joints, including joints of your hands, feet, knees, ankles, and also, as I said, the lower back. Some patients have pain in many joints, while others will have pain just in a few. Unlike rheumatoid arthritis that we're going to talk later, these patients will have one side affected and not both sides affected. Now let's talk about psoriatic arthritis in the hands. The most frequent joints affected are the distal interphalangeal joints and the proximal interphalangeal joints, and sometimes the wrists. At times, patients with psoriatic arthritis will develop swelling of one finger or one toe, and that will look like a saucy digit. We do call that dactylitis. This is actually caused by inflammation of the joints and tendons, and it can be very painful and very difficult to treat. Tendinitis. Tendinitis, or inflammation of the tendons, is very frequently seen in patients with psoriatic arthritis. The elbows, the Achilles tendons, and plantar fascia can be affected. Many patients will experience what we call tennis elbow or golf elbow tendinitis. These tendons can become red, swollen, but they can be just very tender. As you saw in Daniel's case, many patients will have skin psoriasis. The skin can be red, scaly, and itchy. Certain areas of the skin are more prone to be affected, such as the scalp, the hairline, elbows, knees, belly button, and genital areas. And sometimes patients will have psoriasis in the ear or behind the ears. As a rheumatologist, I always ask my patients about rashes, if they had it before or if they have it now. However, as I mentioned, not all patients with psoriasis of the skin will develop psoriatic arthritis. So if you have joint pain, it could be from other reasons as well, not necessarily psoriatic arthritis. Now, to determine if this is psoriatic arthritis, we look for specific signs and symptoms, and we also ask for x-rays to look for some radiological changes. For example, the pencil in a cup. Nail changes. Patients with psoriasis can see effects on the skin, but also on their nails. As a rheumatologist, again, I examine their nails and I look for pits, discoloration, dents in the nails, or lifting of the nails, which can be seen in patients with psoriasis. These are common, but they can be there for many years before the patient will develop joint pain. Eye inflammation. Patients with psoriatic arthritis, like patients with ankylosing spondylitis, they can develop iritis or uveitis, and this is inflammation of their eyes. Uveitis can affect one eye or both eyes, and it can cause pain, blurry vision, or issues with the light. Uveitis is an emergency, and if you do have eye problems, I urge you to call and see an ophthalmologist or an eye doctor, because the damages that uveitis can make can be permanent and can lead to visual loss and blindness. Gut inflammation. Patients with psoriatic arthritis may also describe abdominal pain, bloating, diarrhea. Many patients with psoriatic arthritis, like other spondyloarthropathies, including ankylosing spondylitis, they can have inflammation in their gut. And sometimes we ask for a colonoscopy to make sure that this is nothing else or something else like Crohn's or ulcerative colitis. Thank you very much for watching this video. I hope you learned something new about this autoimmune disease that we call psoriatic arthritis. If you find it interesting, or if you learn from it, or if you know someone that will benefit from it, please subscribe to my channel and press on the notification button to be notified when the next video is released. If you know someone suffering with psoriasis and joint pain, please feel free to share my video with them, as they will benefit from an earlier diagnosis and they will benefit from living with less pain. Have a great day, and I'll see you soon.
RheumatologistOnCall.com